Welcome to Medicine in a Nutshell's Guide to Presenting a Cardiovascular History.
When presenting history, you want to give an in a nutshell summary. Don't simply list everything you found in the order you found it. A useful format to follow is to state, firstly, the background of the case. Secondly, give your impression. Thirdly, give the important positive and negative features which support your impression. 4. Give the differential diagnoses. And 5. Summarise your case. Give an executive summary in one sentence.
Please click the link below to see the examination of Francis, who is detailed in this case.
Now, to summarise our case, Francis was perfectly normal, which means our summary is less interesting. However, we still follow the same 5 steps. So, Francis is a 23-year-old male with a background of good health and no comorbidities. He has no cardiovascular risk factors. My impression was he had no cardiovascular pathology. On examination, he was comfortable at rest. His heart rate was 62 beats per minute, was regular, and of good volume and character. He is normotensive. His heart sounds are normal. I could hear heart sound 1 and 2, and there was no murmurs detectable. He had no stigmata of any other comorbidities or any cardiovascular disease. To summarise, Francis had a normal cardiovascular examination.
Here is a brief example to show how the steps can be used with a patient with pathology.
Mr. Jones is an 86-year-old retired plumber. He is presented with shortness of breath on a background of heart failure and hypertension. On examination, my impression was he was clinically in decompensated heart failure. He was edematous peripherally, he had a raised JVP, fine creps were heard on both lung bases, and he was short of breath on minimal exertion. His heart rate was 64 beats per minute, and his blood pressure was 133/88. He's showing no signs of a systemic or respiratory infection. He is apyrexial and his ECG was normal. There are no heart murmurs and he's saturating at 100% on 2 litres of oxygen via nasal cannula. When listing differential diagnosis, it's important to start with things which are most likely and move on to things which are less likely. It is important to show you considering things in a logical order. Important differential diagnosis to consider would be a chest infection and a PE. In summary, Mr. Jones has an acute heart failure. Here is a good time to give your management options. State what you've done already, for example an ECG and starting him on oxygen, and then say what you'd like to do, for example referring to cardiology and starting on diuretic therapy.
If this video is useful, please like and share. Also, see our other videos on our YouTube channel.